Health Media Briefing. As a reminder, we ask you to mute your phones. Joining us
Okay,
today
they just started the conference. Yeah.
Again, we are asking you all to please mute your phones. Joining us in the room today is Secretary of Health Kim Molston-Risden, Epidemiologist Dr. Josh Clayton, and South Dakota Department of Health Communications Director Daniel Butrelli. At this time, I will turn it over to Daniel.
Thank you, Rebecca, and good morning, everyone. All of the Department of Health thrive on providing all South Dakotans the latest updates and information on COVID-19 as it becomes available. To that end, here is the latest statewide COVID-19 information. New confirmed cases, 64. New probable cases, 22. Active infections, 1,004. Recovered cases, 120,526. Currently hospitalized, 66. Total tests performed, 1,199,327. Total unique persons tested, 472,505, with 123,518 positive cases, 348,987 negative persons. We continue using the RT-PCR positivity rate, since that is the measure being used by the CDC as well as CMS for nursing home and long-term care facility reopening plans. That last 70 number, as of this morning, is 5%. Additionally, 622,350 doses have been administered to 336,010 state residents, translating to 55.9% of the state population having received at least one dose, and 50% of the state residents having completed their vaccination series. Certainly an important milestone in this effort. All this provisional data can be found on our COVID dashboard found at doh.sd.gov, and I will turn it over to our state epidemiologist, Dr. Joshua Clayton.
All right, thank you, Daniel. I just wanted to provide a few updates on COVID-19 cases. So we are seeing a decrease of about 16% in our cases during this past week. The full week, May 2nd through the 8th, we saw about 88 cases per day, and this is down from 96 cases per day from the previous week. As always, we are continuing our monitoring and surveillance for new variants within the state, including the notice recently that CDC is now monitoring the B.1.617, which is the India strain, where it's causing a large number of cases, hospitalizations, and deaths, and overwhelming a lot of their medical provision. So as of yesterday, May 11th, we have 142 variants of concern. The vast majority of those are the B.1.1.7, also known as the UK strain, 121 of those being that B.1.1.7. We've also seen a total of 15 of the B.1.429, which is the California variant, 3 of the P.1, which is also known as the Brazilian variant, 2 of the B.1.351s, which are known as the South African variant, and then 1 of the B.1.427, which is also known as a California variant. In total, of those 142 variants of concern that have been identified, we've had 4 hospitalizations and 0 deaths. Now, we do ask individuals to continue to take precautions to protect yourself. The first and foremost is to get vaccinated. Now is your time to get vaccinated to keep yourself and your family safe. Second is just maintaining those other strategies which have been in use since very early on in the pandemic, including avoiding crowds, physically distancing, wearing a mask when appropriate, washing your hands often, and staying home when you're sick. Would like to just touch on the recommendations for fully vaccinated persons, and just reiterate that, with our numbers in the state, this does open up a lot more safe gatherings for individuals who have been fully vaccinated. Fully vaccinated is defined as being 14 or more days after receiving your last dose of COVID-19 vaccine. So after you have achieved that milestone, you may comfortably visit indoors with other fully vaccinated persons, again, without the use of a mask or physical distancing. Visit with unvaccinated people, including children, from a single household, unless those individuals are at higher risk. Resuming domestic travel and refraining from testing before or after travel, as well as no longer needing to self-quarantine after travel. Resuming international travel and refraining from self-quarantine after you've traveled. And just note that some of the destinations, international destinations, still do require testing prior to you boarding an airplane. And we do recommend that individuals test themselves after they have returned from that international location. Also, avoiding quarantine, routine testing, and post-exposure prophylaxis if you have been recently exposed and as long as you remain asymptomatic. This applies broadly as well as in those non-healthcare congregate settings. So that does mean that it's safe to be outside, with family, friends, and so on. Whether that's attending a barbecue, being in an outdoor setting such as restaurants, and so on, without the need for those physical distancing and masking. But we do recommend that individuals can get tested at any time, and that especially includes individuals who do develop symptoms for COVID-19. We ask that you go visit covid.sc.gov for the free at-home test that will be delivered to you, or you can reach out to your medical provider to get tested there as well. The last thing I'd like to touch on is just that focus around individuals who are fully vaccinated and needing to and reaching towards herd immunity. So it's important to remember that we're working towards achieving vaccination of 70% of all eligible individuals for vaccination within the state, and that's regardless of whether you've had the virus or not. It is important to get vaccinated. If you've had the virus, it does not mean that you're immune. So we have variants that we mentioned before where we might see some reduced effectiveness, not only of individuals who had natural infection, but also potentially of the vaccine. But it's important to recognize that a lot of the scientific articles out there show that vaccine does produce a higher level of antibody against the COVID-19 virus when you compare it to natural immunity, and the potential for that natural immunity through infection to wane over time much more quickly than may occur with vaccinations. So the last thing I'd like to mention is just, we know that vaccines are the quickest and most important way, most direct way out of this pandemic. So with that, I'd like to turn it over to Secretary of Health, Kim Melson-Reisden.
Thank you, Dr. Clayton and Daniel, and good morning. Thank you all for joining us today. At this point, we've seen over 336,000 South Dakotans who have received their COVID-19 vaccine, and I'd like to thank all of those who have chosen to become vaccinated, as we do know it's the quickest way for us to end this pandemic. As Daniel mentioned, this equates to over 55% of our state having received one dose, and 1/2 of our state has fully completed their series. So seeing great progress, but need to continue to get the word out about vaccines and how important they are. On Monday evening, the FDA authorized the Pfizer vaccine for individuals aged 12 to 15. And so we are waiting final CDC authorization. The ACIP committee is meeting today to determine if they will make this vaccine available to that younger population and reviewing all of the data. Again, all of the vaccines have gone through the same safety profile and approval processes to ensure that anything that's available to U.S. citizens are safe and effective. So we're looking forward to getting the results of that committee meeting yet today, and assuming that the ACIP committee recommends the use of the Pfizer vaccine for this age population, we will have vaccine available to individuals who are 12 to 15 years old. Now, we've had questions before about, is it really important for younger people to become vaccinated, because we know older people tend to be more severely impacted. And the fact of the matter is that it's important for all people who are eligible for vaccines to become vaccinated, because that helps slow the spread of the virus in our communities, and that slows down its ability to develop variants. And it slows down its ability to impact those vulnerable people who could still have a breakthrough case if they have been vaccinated or who have not been vaccinated themselves. We continue to see some misinformation floating around But, you know, we really, again, want to reinforce that people need to continue to use trusted sources of information about vaccines, about their safety, about their development, and about their impact on human health. So I wanted to just reiterate a couple of facts, and thank you for your help in getting these out there. What we know about people that contract this virus is that, you know, the COVID virus can travel all over your body and stay there, causing both short-term issues and longer-term issues. But by getting the vaccine, you prime your system to counteract the virus and thus build resistance towards it. 95% of doctors who have studied the vaccine have taken it, and I think that's a great testimony about its safety and efficacy. And so, obviously, the quicker we can put this pandemic behind us, the better we will be able to continue to do the things that we value in our lives and do those safely. So, questions are normal. Fear is not. If people have questions, please come to the DOH website. Again, that's covid.sd.gov. Or call us at 1-800-997-2880, and we'll be happy to get any information to people needing it. So, with that, I also just want to make another plug for testing. Again, if people have symptoms that could be COVID, testing is still important, and we're thankful to people that are continuing to be tested. As Daniel indicated, our testing positivity rate is about 5%, so that means we're seeing you know, many people become tested, and thankfully they're negative. That's important because if we do see cases out there, we really want people to isolate and, again, not contribute towards other cases and the spread in communities. People can go to our website and order a free home-based saliva test. It's easy to use at no cost to the individual. So with that, I think we're taking some questions.
Thank you, Madam Secretary and Dr. Clayton. At this time, we will open the floor for questions. If you would like to ask your questions, please identify yourself, your media outlet, and then ask your question. Who would like to go first?
Abby Wargo with the Rapid City Journal.
Go ahead, Abby.
Hi. Okay, so in Idaho, healthcare providers have been rejecting some vaccine doses as the demand has dropped. Has there been a surplus of vaccine in South Dakota, as most people who want the vaccine have already gotten it? Do you anticipate sending doses back, or what are you planning to do if you have extra doses?
So, Abby, a couple of weeks ago, we moved to an order-on-demand system, and so we've asked our partners that are eligible to get vaccines through the state allocation to order what they anticipate needing in the coming week. But the other thing is that we're seeing more and more access points across the state and being supplied by other sources as well. And so I think it's important that, again, people that have not become vaccinated to keep checking the DOH website. We're seeing vaccine available in clinic offices. We're seeing vaccine available in more pharmacies, as well as federally qualified healthcare center sites across the state. So all of those particular entities, the federally qualified healthcare centers, as well as the federal retail pharmacy center locations, are being supplied directly by the federal government, so that's not kind of out of the state allocation per se.
Okay. Next question, please.
Jacob Mayer, Carolina News. Now.
I heard Jeremy.
Was that Eric or?
Dakota News Now?
Yeah, Dakota News Now.
Oh, hi, this is Jacob. We've talked before when Group 1D came that how big that group was. Do you have any ballpark of how big the group of people 12 to 15 in South Dakota would be?
Yeah.
Hold on one second. We're going to pull that up for you.
We have looked at this, so let just give me a moment as I...
While we wait, can we go back to the, Jeremy, did you have a question?
So, sorry, 48,120. Sorry, it just took me a moment to find that. So individuals who are aged 12 to 15 years of age in South Dakota, we have 48,120 individuals according to the 2019 U.S. Census estimate.
Okay. Going back to our other questions, go ahead.
Yeah, mine was similar with adding the population of 12 to 15. Is the goal still going to be 70% of the 16 and above adult population, or what? How does the 12 to 15 adding that population throw off the goal, I guess, to get as many people vaccinated, I guess?
Well, this is Secretary Malcolm Ryston. The goal of vaccinating 70% of the eligible population will remain, because again, that's the number that we're trying to get to again have an assurance of herd immunity. But by adding, more people to the group that's eligible, that basically changes your denominator. Yep. So it expands the number of people eligible and would therefore reduce our percentage population vaccinated, because the denominator is larger.
And I think it's important to recognize, we're starting talking about 70% is the goal for the Department of Health, and starting to be that lower threshold for herd immunity. We want not only the entire population, of the state, that for those who are eligible to be at 70%, but we're also wanting subpopulations to also achieve that as well, so that we're not identifying pockets of under-vaccination. We want to make sure that we have kind of that uniform level of protection across all population groups and all geographic areas.
Next question, please.
This is Groves from the AP.
Go ahead, Stephen.
I noticed today we had 7 deaths reported, and that was a bit of an anomaly. I think it was the most that we've seen in about a month. But I wonder if you could kind of talk about, first of all, if those were connected at all, and then if you think that we'll see kind of lower death rates as the rate of vaccination increases, and if we will get to a point where, it's out of the ordinary to report a COVID-19 death in the state.
Yeah, and I think when we're talking about both severe outcomes, hospitalization and death due to COVID-19, we are looking at seeing those decrease with our decreasing case counts. A little bit of what we're seeing with that, number of 7 deaths is just the time that it's taking for our processes to report out those deaths. So, with no longer reporting on Saturday and Sunday, the information that you're seeing there is several days worth of reporting that we would normally have spaced out over in time a little bit. So when we do look at this information, we typically do take a look at it on a weekly time point, so that you're avoiding some of those differences or changes that over time that we've seen with reporting as we go to a more structured Monday through Friday reporting updates.
Next question, please.
Kelly Hertz.
Chairman Kugelberg from News Service.
I heard Kelly Hertz.
Yeah, I had a question about the 12 to 15-year-olds. Will they need parental permission or approval, do you think, to get the vaccine, or is that something that's been considered yet? Also, I remember back in February, I think people were saying that by the end of March, the variants would be like the most dominant part of the COVID infection rates, and I'm not sure if that's happened. Can you talk about what may have affected that?
Sure. Kelly, to answer your first question, yes, parental consent is required for any child receiving an immunization. So that would be at play for 12 to 15-year-olds as well as 16 and 17-year-olds.
And to the second part of that, around the variants that we're seeing, it is important to recognize that when we're reporting out the number of variants that we have today, we've seen a total of 142 variants, 121 of them being the B117. That is the, it's specifically a sentinel surveillance system, so that we're not actually testing all positive COVID-19 cases in the state by doing that genomic sequencing. And there's no public health agency across the nation that is doing that, or even other countries, because of the resources that are needed in order to do that. What we do is take a sample of the specimens that we're receiving. And I can say that with what we've seen and what we've seen reported from CDC on this, in many places we're seeing 60 to 70 and sometimes higher than 70% of all of the infections circulating now or occurring now are due to the B117 variant. So we have made that transition in the past several weeks to having the B117 be the dominant virus in the nation as well as in South Dakota.
Next question, please.
Jeremy Kubelberg, Quorum News Service.
Go ahead, Jeremy.
Yeah, I was just wondering if I could get a description. I've seen some of the advertised, some of the TV ads and social media ads, but I'm just curious if I can get a description of the vaccination sort of promotion campaign that's happening. What's the scale and scope of that, and how are you trying to accomplish that herd immunity?
Well, Jeremy, I'll start, and then Daniel can add some more information. So we are, currently communicating and providing information via television, newspaper, Facebook, Instagram, other social media, radio, and again, just addressing, issues so that people, again, have the correct information about vaccines. You will see some additional awareness from some trusted voices coming here in the coming weeks to specifically address groups that that we know are looking for information as well. We are also will be working and are working. We'll be working more with some community organizations to work with individuals that they otherwise serve to help get information out to folks about vaccines and just again so that people have the correct information to make the decision for themselves. So I think media is definitely a part of what we're doing, but it's more than media, and it's really working with community-based organizations across the state so that, again, people can get valid information about vaccines.
Yeah, I think Secretary covered it pretty much all I was going to say. I would also add that, the systems also have campaigns in the regions that in, counties that they're covering, and it's more than just an educational, informational, and also hearing back what are people hearing in the community and being reactive to that.
Okay. Next question, please.
This is Jerry at W1AX.
Go ahead, Jerry.
So the rate of increase of vaccinations has slowed, barely cracking 50% now to get to 70%. I know you want to get there as soon as possible. What's realistic? July 4th, Labor Day? What at this rate? What's it going to take?
Well, Jerry, I think that's a great question. I don't know that we've put a date on it per se. You are correct that we've seen the number of people coming in for their first shot has slowed down compared to the early days. But we also know that, that we're going to need to continue to work on this through the summer months and, just continue to help people make that choice. And we expect to be working, on this for some time.
Okay. Next question, please.
Miranda O'Brien.
With the August leader.
I heard Miranda first, and then we'll go to the August leader.
I was wondering, as we're getting into the summer months, is there a concern with tourism, especially with how hot of a tourism season we had last year?
Well, Miranda, we, are seeing, uptake of vaccines across the country, and so I think that's something to keep in mind. And, we're just encouraging people to pay attention to those mitigation strategies that are important. So if you're around people that you don't know their vaccination status, to wear a mask, try to be socially distanced from them, avoid large crowds of folks that that you just don't know kind of where they're at with their vaccination status. Again, with vaccines becoming very, very available really across the country, that's going to obviously make this tourist season look different than it would have last year.
And then we had a question from the August leader.
Yeah, thank you. This is a question for Dr. Clayton. Today, the New York Times has a poll of epidemiologists that show that activities that they would participate in, and it's fairly conservative. 1 in 5 apparently still wouldn't take mail without precautions. 25% want to go for a hike outside, things like that. I'm kind of curious, from your perspective as an epidemiologist, why that field is, I guess, reacted in this way to coronavirus.
I think when you look at seeing some of the impact that individuals, whether it be in the healthcare realm or kind of in that epidemiology and data science realm, we've seen some of the impact. We know what some of the general concerns are specific to variants probably being the number one concern, to all of the just tremendous efforts that we've had around vaccination. And I think it's reflective of more cautionary group just in general. I don't know many of my colleagues that you would identify as potential risk takers, on a good day anyway. And so, what I would say is that it is a little bit reflective of the type of personality that is drawn to epidemiology, but it also shows some of the knowledge as well as the general concern that we have for the ongoing spread of COVID-19 within our communities. And really, to mitigate that, we're wanting a much wider population to connect with, vaccination and decrease what we see as concerns and threats around variants and so on.
We have time for one more question. Can I please have the last question?